This morning, I'm giving a talk on yoga, the key to resilient self-care during COVID times. So here there are two keywords because COVID time is no longer a keyword. It's become the only word for everybody. So the key to resilient self-care. So resilient and self-care. Resilience and self-care. These are the two aspects that I want to focus on today in the next 40 minutes or so. I am deeply pleased to be part of this conference on Integrative Approach for Mental and Physical Wellbeing during COVID-19 era. And I thank my dear Professor V.R. Sharma ji and the whole team at the Sri Sri University and the Faculty of Health and Wellness for this invitation. I begin by invoking the Guru Parampara, whose blessings enable me to share whatever information and knowledge on yoga that I have. Om Tad Paramparaye Vidmahi Jnana Lingeshwaraya Dhimahi Tanno Guruh Prachodayate Om Om Yoga Maharishi Dr Swami Geetananda Giri Guru Maharaj Ki Jai. Om Puduvai Kalaimamani Puduvai Shakti Yogacharya Amma Ji Meenakshi Devi Bhavanani Guru Mata Ki Jai. Om Shri Guru Pyo Namaha Hari Om. Today I am representing our university, Sri Balaji Vidyapeeth, a deemed university accredited with a A++ grade by NAC, where for the past 12 years we have a Center for Yoga Therapy Education and Research called ICYER. I would just like to check that are my slides moving till now? You can see a slide with our university details. Kindly confirm.
Yes, sir. Yes, sir.
Okay, fine. Just to make sure that I don't end my speech on one slide. Okay. So our focus is a focus on salutogenesis. And this may be a new word for many people because we are normally focusing on pathogenesis. Pathogenesis implies a focus on disease where the pathology is our focus. Whereas when we talk about salutogenesis, it is a focus on health. Salutare comes from Greek and Latin, where salutare is Latin, genesis is Greek. The causes that enable us to be healthy and well. The equivalent in our culture is swasth. And we are moving forward on this transformation from a focus on pathogenesis to a focus on salutogenesis. We all know that when there's a heavy wind, the tree that bends, the tree that can bend does not break, whereas the tree that does not bend, it often breaks. The similar concept is that when you hit a ball, it goes 99 times down, but you always want it to come up 100 times. Because if you can come up 100 times, you have broken through the challenge. So nothing wrong in falling down, nothing wrong in collapsing, but do you come out better at the end? This is what resilience is all about. And there are 6 domains when we talk about resilience. We are talking about the vision, the composure, the reasoning, the health, tenacity, and collaboration, and how the purpose, the goals, how we regulate our emotions, how we solve the problem, what type of resourcefulness do we have, what type of nutrition, sleep, and exercise do we have, the persistence and a realistic optimism, and the capacity to bounce back. And we create support networks, social context, and we manage our perception. All of these domains of resilience, they are all enhanced by yoga. And that is why resilience is basically an outcome of yoga itself. So when we look at yoga, we can understand yoga as the antidote. It rescues us from the vicious negative spiral of mental and emotional whirlpools that are sucking down into the depths of despair. It enables us to break free from the conditioned patterns and tendencies called the samskara and the vasana that are fragmenting us constantly. It is enhancing the power of choice, that superpower of being human. And this is where yoga is all about making conscious choices. We consciously look at a dosha nivarana, letting go of the negativities that are there. We want to regain the samatvam. We want to relax ourselves and rebuild. Through nishpanda, ekaya kalpa anukrama, we want to bring into play. We want to empower ourselves by developing healthy attitudes through pratipaksha bhavanam and the chatur bhavana, maitri, karuna, mudita, upekshanam. We want to enhance the flexibility of the body, mind, emotion, spirit through hatha yoga, developing objective self-awareness of vairagya and swadhyaya, and creating positive relationships through an acceptance. Samabhava bhavana is what we want to cultivate. Many studies have shown us that yoga can reduce the allostatic load and balance the autonomic nervous system. This is a keystone in developing what is today called adaptive resilience. How in any challenging situation like the COVID era, we can adapt to it and we can bounce back better than before. It enables the alignment of the Pancha Kosha, the fivefold aspects of our existence, be it the Annamaya, Pranamaya, Manomaya, Vijnanamaya, and the Anandamaya, anatomical, physiological, psychological, discerning and universal aspects of our existence. And through the prakriyas and the kriyas of Jnana Yoga, we can work with the healing energies to once again regain our balance and go beyond. So when we talk about COVID-19 that has stretched into 22, the COVID era, one of the most important aspects we need to deal with is fear, bhayam, because the whole planet is caught in fear. The invisible enemy, that is the virus, has brought with it another inner enemy that destroys us from within. What is that? Bhayam. And how does it destroy us? Fear, through weakening the immune system. This is where we need to focus on self-care. Remember the two keywords I started with? Resilience and self-care. We need to refocus on our own salutogenesis, swasthya, our capacity and ability to be responsible for our own health and wellness. We need to move forward from pathogenesis to salutogenesis, and we need to strengthen our immune system through yoga. When we do the yoga practices mindfully, we strengthen the immune system by inducing a sense of empowerment and self-confidence, the swabhiman. We regain cortical control. The higher parts of the human cortex come into play, and we can be our true self. Because if we want to help others, we need to be safe and we need to be healthy. In modern times, we call this psychoneuroimmunology. It is about how our thoughts and emotions can affect our immune system, and stress, fear, and negative emotions, they weaken the immune system. And of course, the topic of our whole conference, yoga, including the meditative aspects. Never forget, dhyana or meditation is the heart of yoga sadhana, especially the antaranga sadhana. And mindfulness, positive emotions, and relaxation, they strengthen it. So the psychoneuroimmunology is based on the nervous system, the immune system, and the endocrine system. And when we put stress into it, we have a negative outcome. When we put yoga into it, a positive outcome. Because the limbic overactivity, our limbic system, the limbic system which comes into play and brings in fear, and the emotional turbulence. Remember, this emotional turbulence is where we lose control over ourselves. Like Lord Krishna says, Dhyayato Vishayan Pumsa, Sangasteshu Vajayate, Sangat Samjayate Kama, Kamat Krodho Abhijayate, Krodhat Bhavati Sammoha, Sammohat Smriti Vibhrama, Smriti Bhramshat Buddhinasho, Buddhinashat Pranaschati. Because all of this is based on Raga and Dvesha. So you have to go into that state beyond it. Raga Dvesha Vimukta Istu Vishayan Indriyas Charan. Atma Vashye Vidayatma Prasadam Adhigacchati, says Lord Krishna in the Bhagavad Gita. A yoga shastra by the Yogeshwar himself. So the limbic system is reducing our immune capacity through fear. And we need to move from bhayam into abhayam. And when we can do this, we change the whole cascade. Because once fear comes in, once negative emotions come in, the stress response that comes in, it weakens the immune response and we become open to all sort of infections and pathologies. And that is why we have to work right at the perception. We have to change the perception of stress itself through the yoga bhavana, the yoga drishti. This is why my beloved father and guru, Swami Geetananda Giri Guru Maharaj, he said the first disease is the sense of dvitiyam, duality. Because from the dvitiyam comes bhayam. And we have the imbalance of the mind leading to the diseases in the body. This is called Adi Vyadi in our yogic parlance. My dear inspirational mentor, Selvamurthy sir, he recently gave us a talk and he reiterated that yoga is a 3-in-1 action. How? It modifies our perception of the stress. Remember, the first thing is here, you have to modify how you perceive the challenge, the stress. You then have to optimize your response. How are you responding to the challenge? And third, all the stress that is pent up, you need to release it. So through the different practices in yoga, you release the stress, you optimize your response, and you modify your perception. 3-in-1 action of yoga. Just a couple of days ago, I met a senior professor who had studied with my father many decades ago. And this professor went through a horrible COVID infection over the second wave. And what he told me, he said so many times during that COVID illness, he said voices in me, inner voices were saying, get over with it. Just jump off the roof and end it all. Suicidal tendencies were coming. Why you want to suffer? You're already 80. Why you want to suffer with all of this? Just jump out the window, jump off the roof, get it over with. And he said, I was able to deal with this. I was able to deal with it because the teachings of yoga given by your beloved father and sustained by your mother and you. He said, I would not be alive if it were not for your father's teachings of yoga that enabled me to realize what is real and what is not. Remember that beautiful prayer that we have, Asatoma Sadgamaya, Tamasoma Jyotirgamaya, Mrityoma Amritangamaya, that is brought into action. The philosophy becomes the practice through yoga. And that is why a very special moment for me when he talked about it, and I once again realized yoga is truly amazing. Now we have gone through the acute phase. Many countries are still struggling with it. Different waves have been coming. But now what we are dealing with is another pandemic of long COVID, the long-term effects of COVID-19 that are especially found in the elderly patients, people who already had underlying disease like chronic lung disease, high blood pressure, heart disease, and obesity, metabolic syndrome, people who had pneumonia by COVID-19. And what we find is the male patients have more tendency for long COVID. This post-COVID condition, what we find is there's a wide range of new, returning or ongoing health problems that are found 4 or more weeks, sometimes 3 months also, which is 12 weeks after being infected. And even people who didn't have their symptom when they were infected, they can end up with post-COVID. So when you had COVID, there were no symptoms. You said, it was a mild case. Later on, you may suffer post-COVID. And this has different terms: post-COVID, long haul COVID, post-acute COVID, all these type of terms or chronic COVID are coming into parlance. And the WHO, in their Delphi method of consultation, they found that usually 3 months from the onset of COVID-19 and lasting at least 2 months. And they say the most important part is a diagnosis of exclusion. So you are not finding the cause and you are going through all the tests and the symptoms are still there, the problems are still there. Well, it may be long COVID. And common symptoms, fatigue, shortness of breath and all they are finding. And the symptoms may fluctuate or relapse. What are the type of post-COVID conditions? The new ongoing symptoms, difficulty in breathing, shortness of breath, tiredness, brain fog, you lose the clarity, cough can be there, headache, joint or muscle pain, body ache, fever, rash, change in menstrual cycle. You look at that list and it could be anything basically. And you have to think about that. And fatigue is by far and large a very important one. Joint pain is another important one. And that is why the fatigue, brain fog, headache, sleep disturbance, and dizziness. These are the most common long COVID symptoms when they were tested out. They had a look at this test and this is what they found. And in our own hospital, this is what we are finding with people who are coming with the long COVID. There is another issue also happening that the multi-organ effects are being there. So a multi-organ effects that could affect your heart, lung, kidney, skin, brain, and autoimmune condition. And in children, what they are finding, multi-system inflammatory syndrome, where tiredness, fatigue, headache, trouble sleeping, trouble concentrating, muscle and joint pain and cough. This is coming. So the child goes through a mild COVID, but later on is complaining of a multi-system inflammatory syndrome. And this may be because of viral antigen persistence, systemic and tissue-specific inflammation. There could be a reactivation of the human herpes virus, dysbiosis of the gastrointestinal tract and your biome there, microvascular dysfunction, and specific and autoreactive immune responses. They are finding this to be the cause of this. And again, so many other people who are hospitalized in COVID, what we find is that during recovery, severe weakness and exhaustion are there. And there could be a post-intensive care syndrome, PICS. When they have been in the ICU for a long time, severe weakness, there can be problems in thinking and making decisions, and PTSD, post-traumatic stress disorder, which is why today I'm questioning whether we as a race across the planet, we are now suffering, are we all suffering post-COVID traumatic stress disorder? This is a question that we need to address if we are to look at integrative approaches for mental and physical wellness. This is where yoga comes in as a therapy, yoga chikitsa. Because through the mind, we can create healing and reduce suffering. We can, through the body, work on restoring functions and creating healing. And we can also work with the spirit. That is one of the plus points of yoga as a therapy, by reducing suffering and creating community. So working at body, mind, and spirit level, we are able to look at the kaya, the mana, and the atma levels. Because if we go back to the definition of swast by Acharya Shushrut, samadosha sama agnischa samadhatu malakriya prasanna atma indriya mana swastitya bidiyate. And we are able to work on that swast. Again, we want to heal. Healing is different than curing. Curing is only looking at the symptoms. Healing is where you want to come back to that sense that I am me. I have come back to that state where once again I feel I am myself. I feel a sense of purna arogya, purna swast. That is what is healing. And for this, our lifestyle, our attitude, the breathing and the relaxation, all of them are factors. So if you look at lifestyle, already yoga is the best, healthiest lifestyle for human being. We look at achar, vichar, ahar, vihar, and vyavahar, the five-pronged lifestyle approach. We look at the attitude, cultivation, reconditioning of our psychological attitudes with pratipaksha bhavanam, and the adoption of the chatur bhavana, maitre, karuna, muditopekshanam, Sukha dukkha punya punya vishayanam bhavanatah chitta prasadanam. What beautiful attitude changes along with living the yama niyama, ahimsa, satya, asteya, brahmacharya, aparigraha, yamaha, and saucha, santosha, tapas, swadhyaya, ishvara, pranidhana, niyamaha. We are living the Yama Niyama. We are applying Pratipaksha Bhavanam whenever the Vitarkas are coming up. Remember the professor who said there were these suicidal tendencies. They are the Vitarka. You apply the Pratipaksha Bhavanam at that time to counter the negativities. And the breathing, focusing on our breathing apparatus, because through the breath moves the life force, the prana, and the mind and the breath moving together. Yado mana tata prana. So that we enhance the prana, so that all the pancha prana vayu, prana, apana, samana, udana, dhyana, they are working along with the upaprana vayus, naga, kurma, kukara, deva, datta, dhananjaya, and the paraprana vayu of chitra and akasha prana vayu. Dwadasha pranas, all of them are working, inducing a sense of healing, health and wellness at all levels of existence. And relaxation. Because relaxation is the key to healing. It is a prerequisite to heal. We cannot heal when we are stressed. When we are stressed, we cannot heal. And this is why conscious, mindful relaxation facilitates self-healing. We educe what is called the relaxation response. And I keep on saying this again and again. In every place where I talk, relaxation may be yoga's greatest contribution to modern healthcare. Because it is a non-pharmacological, cost-effective, and it can be done by the patient themselves. It is empowering the individual, self-care. We have looked at so many long COVID situations and breathlessness, palpitation and all we found. And when they come for the yoga practices, especially the pranayama and relaxation is our combination. SpO2 going up from 94 to 98, a tremendous improvement. Because many people after COVID are still having a low 90 level of SpO2. And so they are having fatigue and they are not able to move around. The endurance and all the physical capacity has gone down. And reducing the pulse rate. The pulse is an indicator of how stressed you are. So when the pulse is 103, it is tachycardia. You are very stressed. Bringing it down to 89, you are de-stressing the person, relaxing the person, and enabling them to function at an optimal level. Similarly, conditions where there is vertigo. Remember we talked about dizziness, giddiness, difficulty in breathing, severe fatigue. And we have found even with our own faculty members, how when we start to do this, the person is benefiting and becomes a champion of yoga. They become someone who goes out and they will stand up for yoga. They become a role model, a champion. And they become a voice for the power of yoga itself. We looked at the people who are working with the patients, the healthcare providers, our nursing staff and others. And they are also stressed. The blood pressure, see 133 by 81. The mean coming down 123 by 79. Heart rate coming down from 79 to 73. And even in them, an enhanced SpO2 from 97 to 98. The improvement in overall health for the healthcare provider. So one is the patient benefiting. Second is the healthcare provider. They should also benefit. And so we are also looking at how Pranava Pranayama, one of the keystones of our therapy, utilizing the Akara, Ukara, Makara and Omkara Nada, how we can enhance the SpO2. And you can see from 96.1 to 97.69. It is going up when you do the pranava. If you're just quietly sitting, it's not going up, it's actually coming down. And the heart rate also falling, signifying the person is more relaxed and they're able to breathe better and tissue oxygenation is improving. And what was the practice? The pranava. Now pranava is a universal vibration. Tasya vachakaha pranavaha. Tadartha bhavanam. Tad japaha tadartha bhavanam. Tada pratyak chedanadigamah antaraya abhavascha, says Maharishi Patanjali. All these antarayas, the obstacles that are coming up because of the COVID challenge, you want to get rid of it. Pranava Japa. And it is found in all cultures. So we perform a practice where we do the Akara Nada using Chin Mudra. We do the Ukara Nada using Chinmaya Mudra. And Makara Nada using the Adi Mudra. And we combine it all into the Brahma Mudra where we start to perform a deep breath and breathing out with the sound of ha, oo, and as you extend the exhalation, the vagal tone is strengthened, the sinus arrhythmia is strengthened, and you are relaxing the heart and relaxing the body and the mind and the emotions. When you do the Pranava Japa, it is attenuating the limbic overactivity. You may remember in the beginning of my talk, I said this emotional volatility, the limbic overactivity is weakening your immune system. When you are doing the mantra japa, what is happening? The higher cortex is coming into play. The emotion levels are coming down and you become calm and relaxed. And that is why the Pranava mantra japa, Pranava pranayama, dhyanam and relaxation, using the akara, ukara, makara, we are able to relax the person, bring them into a state of nishpanda bhava and enhance the immune function. I would like to remind that we cannot say, oh, there is no problem. The first stage is to accept there is a problem. The second stage is to think, what can I do about it? And that is why we need to be aware of the suffering, the dukkha that is there. We need to retain our clarity, our viveka buddhi, and have the calmness, the samatvam, and the strength, the viryam, so that we can transform the situation. Yoga is all about transformation and transcendence. And that is why Maharishi Patanjali gives us the threefold parinamas. That is the Samadhi Parinama, Ekagrata Parinama, and the Niruddha Parinama, to transform our consciousness and transform, moving from dukkha to sukha, from roga to arogya. And this is why here at ICYER, over the past 2 years, we have given a holistic integration of yoga therapy with modern medicine. All our faculty members and students of the SBV family, they have been getting the yoga, the Rural Health Center for the local community outreach, focusing on Divyanga, silver citizen, and the transgender population. All our students have been practicing both offline when possible and online when the offline classes are not happening. We have continued with online yoga sessions as part of a salutogenic policy of our university, that all the healthcare students, be them MBBS, dental, nursing, physiotherapy, pharmacy, allied health, they all get an exposure to yoga during their time at SBV. Again, the employees, because we found that they are all having anxiety, they are all having stress. So through our personal department, we did programs and we are continuing them. 48% reduction in anxiety when they are doing these sessions, because you are helping them breathe healthy. You're helping them to relax and the anxiety levels are coming down. You can see how they are all enjoying these practices through the ICYER. Similarly, for the class 4 employees, for the rural health situations and for patient care, giving them opportunities to benefit from the power of yoga. And when the patients are admitted in the COVID ward, our yoga instructors, Danu, Shapna, Desh and Charulata, they went into the wards. They are COVID warriors, yoga COVID warriors, taking yoga into the ward to help the patients recover. And once they recover and go home, home care packages, e-healthcare services, so that they can stay safe and stay healthy. And every one of them has reported so much benefit. They feel so much a sense of wellness. They have that sense of arogya and swasth. And to reach out to the greater community, videos highlighting yoga for self-care during the pandemic by our team that are available on our YouTube channel and on our Facebook page. And the power of Prarthana, 108 days, twice we have done this, 108 days of Vishwa Yoga Prarthana, bringing together like-minded souls from all over the world, so that every day we focus our mind on wellness, on health, on abundance, on bliss, remembering that Satchit Anandam is our essential nature. Because we need to stay safe, we need to stay healthy. And through this yogic self-care, we reduce our fear. We move from bhaya to abhaya. We strengthen our immune system. and manifest all-round health by self-reliance and self-resilience. May we as one humanity, Vasudhaiva Kudumbakam, stand our ground, fight that external enemy which is COVID-19, overcome the inner enemy which is Bhayam, strengthening our ability to fight and defeat this external enemy once for all, manifesting the Swasth Bharat, not just for Bharat, but for the Vishwa Swasth also, moving from pathogenesis to salitogenesis. I end my keynote today with a very favorite quote of mine, that the highest attitude we can have as a human being is the attitude of gratitude. Kritagnyata is the highest attitude we can have. When we have gratitude for life, automatically the abundance will come into our life, be it at the level of the physical wellness, the mental wellness, the spiritual wellness, the emotional wellness, even financial wellness, and the highest wellness where we realize who we truly are, so that we can once again be established in Swarupe Avasthanam. That is where we can be in that beautiful state of Samadhi and going into the higher levels of Tasya, Saptada, Pranta Bhumir Prajna, working towards Dharma Mega Samadhi and ultimately Kaivalya, which is our goal always. Health and happiness are our birthright. Moksha, Mukti, Nirvana, Kaivalya is our goal. So with this message, thanking you on behalf of Saiter of Sri Balaji Vidyapeeth, you can connect with us through our Facebook account, our YouTube account, our website and email, and looking forward to all of you taking the message of yoga as a means of self-care and a means to develop resilience during the COVID-19 era, because we can change the future by what we do now. The future lies in the present moment. In the present moment, when we make a choice, that choice will create a happy, healthy, and abundant future. And I wish that everyone who's participating in this event should be blessed by the capacity to make the choice and enjoy that abundant future of Satchit Anandam. Anandam, Anandam, Satchitanandam. May that manifest for everyone. Dhanyavadaha. Thank you so much for having me today and giving me an opportunity to share my thoughts with you. Thank you so much.